What is hemochromatosis, and how does iron overload affect the liver? Imagine your body as a finely tuned machine, where balance is everything. Hemochromatosis is a condition where that balance gets disrupted because your body absorbs too much iron from food. This is mainly caused by genetic mutations, especially in a gene called HFE, which controls how much iron your intestines take in. If you inherit two copies of the mutated gene, you are more likely to develop this disorder. It mostly affects people of Northern European descent and often shows up in middle age. Men tend to get symptoms earlier because women lose iron naturally through menstruation, which can delay the disease's onset. When too much iron builds up in your body, it doesn't just stay in the blood. It deposits in organs like the liver, heart, and pancreas. The liver is especially vulnerable because it's the body's main iron storage site. Normally, the liver safely stores iron, but when overwhelmed, excess iron starts to cause trouble. It produces harmful molecules called free radicals that damage liver cells. Over time, this damage can lead to inflammation and scarring, known as fibrosis. If the scarring becomes severe, it turns into cirrhosis, which is a serious condition where the liver's ability to function is greatly impaired. Cirrhosis also raises the risk of developing liver cancer, specifically hepatocellular carcinoma. Early signs of hemochromatosis are often subtle. You might feel tired, have joint pain especially in your fingers and knees, or experience abdominal discomfort. As iron continues to accumulate, symptoms can worsen to include an enlarged liver, yellowing of the skin and eyes called jaundice, and even signs of liver failure. The skin may develop a bronze or grayish hue due to iron deposits. If left untreated, iron overload can also cause other health issues like diabetes, heart problems, arthritis, and hormonal imbalances. The good news is that early diagnosis and treatment can prevent many of these complications. The main treatment is regular blood removal, called phlebotomy, which helps lower iron levels safely. This simple procedure involves removing a pint of blood usually once a week at first, then less often as iron levels decrease. It's a highly effective way to prevent progression to cirrhosis and reduce the risk of liver cancer. For those with advanced liver damage, a liver transplant might be necessary, but this is usually a last resort. Doctors often recommend genetic testing and screening family members to catch the disease early before significant damage occurs. In summary, hemochromatosis is a genetic disorder that causes the body to absorb and store too much iron, especially in the liver. This excess iron damages liver tissue, leading to scarring, cirrhosis, and increasing the risk of liver cancer. Recognizing the signs early and managing iron levels through treatment can help protect your liver and overall health. Always consult healthcare professionals for personalized advice and testing if you suspect you might be affected by this condition.